Hi friends, welcome back. Today we are with a theory portion that is a pharmacokinetics and basic consideration coming under the biopharmaceutics and pharmacokinetics. After a long time we are with the theory portion, but this portion is very important for the students in the purpose of theory purpose, and this is also important for preparing the competitive exam. This should not be skipped for the theory as well as preparation, so we can start the journey together. First of all, the duration of a particular therapy, if it is single dose or a multiple dose for relieving an acute condition or chronic condition, we know if it is lifelong, like that is like hypertension, diabetes, asthma, or epilepsy. We know the frequency of administration of a drug in a particular dose, that is known as the dosage regimen. So we want to adjust this dosage regimen for the acute as well as the chronic condition. To adjust that dosage regimen, we know the kinetics. That is simply the importance of kinetics. And the kinetics include the portion we have covering in the first portion in the biopharmaceutics, that is the absorption, distribution, metabolism, and excretion. And the kinetics become pharmacokinetics when we know the relationship with the pharmacological, therapeutical, or toxicological response in men as well as in animal. These are some definitions in pharmacokinetics. You may get confused in kinetics, what is difference between the pharmacokinetic, clinical pharmacokinetic, population pharmacokinetic, and toxicokinetic. I can make it simply. If we are applying the concept of pharmacokinetics for treating a patient, that is clinical pharmacokinetics. But in case of population pharmacokinetics, we are studying what are the difference in various population groups, and applying that concept is the population pharmacokinetics. Whereas in toxicokinetics, we are applying the pharmacokinetic principle for safety of a patient. That is simply toxicokinetics. The thing is that the word ending with the pharmacokinetics, that is clinical or population or toxicokinetics, it is the simply the application of the concept of pharmacokinetic. If it is used for the safety and effective patient of an individual patient, it is clinical. If it is dealing with a population, it is population pharmacokinetics, and if it is giving more priority to the safety and interpretation of the safety evaluation study, that is toxicokinetics. So we can move the basic of the plasma drug concentration time profile. This diagram should be known in mind because this is very important, and this is a plasma drug concentration time profile after we had a particular oral administration, either a tablet, capsule, whatever it is. So first of all, we want to know what are the plots. That is, in y-axis, the graph should be plasma drug concentration versus time profile, and by plotting either in graph or with the help of a diagram or a software, this is a schematic representation of the curve. And the first portion show the absorption phase, and after the bell shape show the post absorption phase, and finally it's eliminated. That is simply as in our body. So the highest peak is the peak plasma concentration, and we can find out some term, the intensity of action, Cmax, Tmax, MXC, MEC, etc. The thing is that basic thing, only achieving this Cmax, the drug show its activity, or if it is below, it should not produce a effect. That is this therapeutic level, that is this therapeutic range, that is only attaining this intensity of action the drug may produce the maximum therapeutic action. If it is not in the therapeutic range, it is in the subtherapeutic level, so it does not elicit action if the dose is so high that may cause toxic level. This is the basic concept. So we can move into the terms used in pharmacokinetics. Before going to the terms, we can deal with two categories that can be evaluated in the plasma concentration time profile. One is the pharmacokinetic parameters and pharmacodynamic parameters. Simply, you kept in mind that kinetics deal with what the body does to the drug, and dynamics means what the drug does to the body. Dynamics, drug effect, and kinetics related to the body. Simply, we can explain with the help of a tablet. For example, if we had a paracetamol tablet, what the body does to the paracetamol, that is kinetics, and the effect produced by the paracetamol is the dynamics. Dynamics, drug effect. So we can move into the first of all into the pharmacokinetic parameters. First, what is peak plasma concentration or Cmax? It is expressing in milligram per ml, that is the point of maximum concentration of the drug in plasma. Maximum concentration, that is Cmax, and it is expressed in microgram per ml and depend upon the dose administered, the rate of absorption and rate of elimination. And if it is less, as we already said, minimum effective concentration. If it is less than that, is maximum safe concentration. So in between we have to obtain our concentration. The time of peak concentration means the time for the drug to reach the peak concentration in plasma. This time of peak concentration or Tmax. It is expressed in hours and gives the rate of absorption. And this assesses the efficacy of the drug used to treat the acute condition. And third term is the area under the curve. It is expressed in microgram per ml into hours, and it gives the extent, how much extent or the total integrated area, that is we are plotting while plotting a graph and calculating the total integrated area under the plasma time profile. AUC is important for the drugs that are administered repetitively for the treatment of chronic conditions like asthma or epilepsy. Going into the pharmacodynamic parameter, these are the drug effect producing. That is the MEC, MSC, onset of action, onset time, duration of action, intensity of action, therapeutic range, and index. So, what is MEC? That is the minimum. M means minimum effective concentration. That is the minimum concentration of the drug in plasma required to produce the therapeutic effect. If it is below the MEC, that is subtherapeutic level. In case of antibiotics, there is MIC, that is different. MEC and MIC is different. In case of antibiotic, that is minimum inhibitory concentration. Here we are discussing minimum effective concentration. Next term is maximum safe concentration. That is simply the concentration of the drug in plasma above which no adverse or unwanted effect are there. If it is above MSC, that may lead to toxic level. Onset of action, that is the beginning of the pharmacological response, or from where the drug may produce a pharmacological effect, that is onset of action. In onset time, this time required for the drug to start to produce a pharmacological response. That time is onset time. Duration of action is the time period for which the plasma concentration remain above the minimum effective level, that is duration of action. Whereas the intensity of action is the maximum pharmacological response produced by the peak plasma concentration of the drug, that is the peak response. And in the therapeutic range, it is the drug concentration between the MEC and MSC, that is the therapeutic range, whereas therapeutic index is the ratio, that is the ratio of MSC to the MEC, that is the therapeutic index, that is MSC divided by MEC. Here we can find out the ratio of dose required to produce the toxic or lethal effect to the dose required to produce the therapeutic effect. By this, we come to the end of the session. We can take the remaining section in coming session part by part to making more interesting and making the concept clear. So please share the video with your friends and make it concept clear. If you are not subscribed till now, please subscribe, share and support. Thank you for the watching. Thank you once again.